Welcome to aminacademy.com. In human anatomy and physiology, let us talk about the cardiovascular system. In that, we'll discuss about shock. Shock, that is a circulatory failure, occurs when the metabolic needs of cells are not being met because of the inadequate blood flow. In effect, there is a reduction in circulating blood volume, in blood pressure, and in cardiac output. This causes tissues hypoxia and inadequate supply of nutrients and the accumulation of waste products. The number of different types of shocks are described here. Hypovolemic shock. What is that? This occurs when the blood volume is reduced by 15 to 25%. Cardiac output may fall because of low blood volume and hence low venous return as a result of different situation. Cardiogenic shock. This occurs in acute heart diseases when the damaged heart muscle cannot maintain an adequate cardiac output, that is in myocardial infarction. Septic shock, that is a bacteriomic endotoxic. This is caused by severe infections in which bacterial toxins are raised into the circulation. These toxins trigger a massive inflammatory and immune response, and many powerful mediators are released. Because of the response is not controlled, it can cause multiple organ damage, depression of myocardial contractility, poor tissue perfusion, and tissue death. That is called necrosis. Profound hypertension occurs because the inflammatory mediators cause profound vasodilation. Next one, neurogenic shock. The causes include sudden acute pain, severe emotional experience, spinal anesthesia, and spinal cord damage. The spinal anesthesia and spinal cord damage. These interfere with normal nervous control of blood vessel diameter, leading to hypotension. Anaphylactic shock. Anaphylaxis is a severe allergic response that may be triggered in sensitive individuals by substance like penicillins, peanuts, or latex rubber. The vasodilation provoked by systemic release of inflammatory mediators. Now we'll discuss further about detail about the cardiovascular system of shock. Shock is a life-threatening conditions where the circulatory system fails to adequate delivery oxygen to the body cells and tissues, leading to cellular hypoxia and organ dysfunction. Cardiogenic shock specifically occurs when the heart is unable to pump enough blood to meet the body's need, often due to severe heart attack or heart failure. Further detail about shock. Circulatory failure. Shock is characterized by significant drop in blood pressure and reduced blood flow to vital organs. Cellular hypoxia. What is that? Inadequate oxygen delivery to cell leads to a state of hypoxia where cells cannot function properly. Organ dysfunction. As shock progresses, organ failure can occur due to the lack of oxygen and blood flow impacting various organs. Cardiogenic shock. Heart failure. Cardiogenic shock is a type of shock where the heart's inability to pump effectively is the primary cause. What are the causes for that? It is often triggered by a severe heart attack, but other conditions like heart failure, heart valve problems, or chest injuries can also lead to cardiogenic shock. Consequences. Cardiogenic shock is a medical emergency that requires immediate treatment to prevent organ failure or and death. Signs and symptoms. Low blood pressure. Systolic blood pressure may drop below 90 mm of Hg or stay below this level even with supportive measures. Rapid heartbeat. The heart may beat faster than usual in an attempt to compensate for the reduced blood flow. Shortness of breath. Difficulty breathing is a common symptom as the lungs may not receive enough oxygen. Cool, clammy skins. The skin may feel cold and damp due to constriction as the body tries to shunt blood to vital organs. Confusion and restlessness. Reduced blood flow to the brain can cause mental confusion and agitation. Decreased urine output. The kidneys may not receive enough blood flow, leading to reduced urine production. Other symptoms, chest pain, fatigue, and loss of consciousness can also occur. What are the diagnoses? Clinical assessments. Doctors will assess symptoms including low blood pressure and signs of organ dysfunction. Electrocardiogram, ECG or EKG. These tests measure the heart's electrical activity and can reveal abnormalities. Chest X-ray. These images test can show sign of fluid buildup in the lungs. Blood test. Blood tests can help identify organ damage, infections, and heart attack markers. Echocardiogram, ECG. Echocardiogram. This ultrasound test can visualize the heart's structure and function. Cardiac catheterization. This procedure can identify blocked or narrowed arteries. What are the treatments? Immediate support. Treatment often begin with supportive measures like oxygen therapy, intravenous fluids, and medications to stabilize blood pressure. Addressing the cause. The underlying cause of the shock, that is, heart attack, heart failure, needs to be addressed. Medical procedures. Depending on the cause, treatment may include procedures like coronary artery bypass surgery, valve repair, or the use of mechanical heart pump. Prognosis. What is prognosis? Survival. Cardiogenic shock is a serious condition and the survival rates vary depending on the underlying causes and the speed of diagnosis and treatment. Prompt treatment. Immediate medical care is crucial to improve the chances of survival and reduce the risk of organ failure. So far, further, what is the cardiogenic shock? It's a life-threatening conditions. Cardiogenic shock is a serious conditions where the heart can't pump enough blood to meet the body's needs, leading to a decrease in blood flow to vital organs. This can result from the heart attack, heart failure, or other issues affecting the heart's ability to function properly. The condition is a medical emergency and require immediate treatment to restore blood flow and protect organs from damage. What is the septic shock? That is a bacteriomic shock, that is endotoxic. Septic shock is known as a bacteriomic or endotoxic shock is a life-threatening condition caused by severe infections, often bacterial, that triggers as widespread inflammatory response in the body. This inflammatory response leads to a drop in blood pressure, hypotension, and organ dysfunctions, while the terms endotoxic is often associated with the presence of endotoxin, a lipopolysaccharide found in the cell walls of gram-negative bacteria. Gram-negative bacteria, it's important to understand that endotoxin can be a factor in all forms of septic shock, including those caused by other pathogens or non-bacterial sources. Neurogenic shock. What is that? Neurogenic shock is a type of shock that occurs due to disruption of the autonomic nervous system, often following a spinal cord injury or other central nervous system damage. These disruptions can lead to a decrease in blood pressure, that is hypotension, and a slow heart rate, that is bradycardia. In neurogenic shock, the body's ability to regulate blood vessels and heart rate is impaired, potentially leading to the dangerous decrease in blood flow to vital organs. And what is anaphylactic shock? Anaphylactic shock is a severe, potentially life-threatening allergic reaction that can cause the bodies to go into shock. It's characterized by the sudden drop in blood pressure and airway obstruction require immediate treatment. So far, we discussed in cardiovascular system what is shock. We have done. Please subscribe our YouTube channel.